Alright, so we're going to try this. Sorry I couldn't be there tonight. I'm going to try to record a couple of shorter videos and hopefully you can hear and this will work. So um, I'll wait to test out on a shorter one at first, but what we're talking about today is physical disorders and health psychology. So what we're looking at here is the impact of stress, essentially, on your physical well-being. And we know that there's a long history of being a very strong connection between physical health and mental health. We know from our discussions in anxiety and depression that a lot of times physical symptoms are a manifestation of your mental health condition. And so stress, anxiety, depression can all lead to problems with that present themselves physically. And we see this very often in things like headaches, backaches, like stress in your jaw and your shoulders, tension. Tension often appears in the body, but it can get more serious than that. We can see as a result of the, we can see some very serious illnesses like AIDS or cancer, heart disease that are affected negatively by the amount of stress, and it can even be triggered by stress. That's not to say that stress necessarily causes these things, but can be a significant factor, particularly with something like cancer, which is talk about inflammation being a huge cause of cancers in general. And one of the things we know that is chronic stress can create that same type of inflammation in the body and thus create the greater likelihood. You see it on a smaller level, excuse me, a smaller level when we're talking about things like colds. You see, you'll probably notice in yourself or in the past having more colds or flu or just illness or not feeling well in general in stressful times. It increases our likelihood of developing just even minor conditions or colds or what have you. Some of the things that we'll talk about, and again, this will be over the series of a couple of different videos that I'll record them all at once. Some of the differences between health psychology and behavioral medicine and the relationship between immune system and stress, talking about AIDS, cancer, heart disease, and the impact those play, and some of the causes and what we can do about these types of things. So, excuse me. Again, we've long known that mental health and physical health are closely linked, and psychological factors are heavily play a heavy influence in many diseases. You look at some of the examples listed there. Genital herpes, for example, inflammation or severe infections often comes in times when you're under a great deal of stress. Chronic stress can make it more likely for you to develop worsening symptoms with HIV. Didn't cause herpes, but it certainly exacerbates the condition and makes it more likely you're going to suffer sort of a flare-up, so to speak, in terms of symptoms. Same thing with cancers, heart disease. Heart disease is one that is probably more closely linked to stress because chronic stress can create such a toll on your body that it actually increases your likelihood of having a cardiovascular event or a heart attack. We all know and have heard that stress can cause heart attacks, prolonged exposure to stress, and you think sometimes that is often a trigger. A very stressful or traumatic event can be a triggering factor for something like a heart attack. So it's important for us as clinicians to be sure to not brush off any of these factors, any of these significant medical factors. They are clinically relevant. So if we're talking about depression, we have to also look at some of the health considerations that are going on with different people. So if someone has a history of heart disease and they're dealing with depression, it's important to note because that will impact how you treat it and how you view the condition. It can also impact the types of medications that you would use and what have you. But it is important for clinicians to make sure to make note of any medical diagnoses whenever they're talking about physical diagnoses. So in terms of definitions, behavioral medicine is the application of behavioral science to preventing, diagnosing, and treating medical problems. And health psychology is a part of behavioral medicine, studies psychological factors that promote and maintain good health. So what we're looking for is promoting healthy psychology. You can see all of these things that are in the way here with the picture. All right, I figured out I could press pause so you don't have to listen to me cough. So one of the examples here, psychosocial factors like negative emotions and stress disrupt our basic biological processes, which lead to physical disorders and disease. So your stress creates a sense of lack of self-control, increases your likelihood to engage in risky behavior like drinking, smoking, using drugs, not exercising, things that we're using to sort of self-medicate to help us through dealing with stressful events. And that can in turn create a more of a problem and exacerbate some of those problems. So, obviously if you're smoking to deal with your stress, it can create health issues that are directly linked to your coping skill for doing that. Same with drinking. It can cause you liver disease. It can cause you alcohol-related problems specifically, but it can also have indirect impacts. The liver problems or brain functioning as a result of your drinking. So there is a very direct link between the two. We look at how do psychological and social factors influence our medical illness. Generally two paths. Psychological factors can influence the biological processes, and again, the long-standing behavior put people at risk for disease. And AIDS is an example of both of those things. The psychological factors can influence the behavioral process, so the stress can make the symptoms worse, but also the risky behavior that some people use to cope with stress can be the cause of the disorder in the first place. So about half of the cases in the United States are linked to lifestyle and behavioral patterns. So unprotected sex or engaging in generally risky behavior, drug use, intravenous drug use, not cleaning needles, that sort of thing, sharing needles. So very clear example of how that works in real life. And we're going to end the first video there, and I'll be back later with part 2.